You're listening to 419 Education and Training Need to Connect podcast. Hello, everyone, and welcome to another episode of 419 Education and Training Need to Connect podcast. I am your host, Devonna Willis with 419 Education and Training and the founder and organizer of the Black Massage Therapist Conference. And today we have the wonderful Dr. Dominique Carson with us today. And we're going to be talking about all the things she has going on in her life and why I brought her on into being part of the conference. And we're going to talk about that. But first, before we get started, little housekeeping. So number one, remember, please register. We have our different tiers of registration. So please look on the calendar and see where we are in the tiers because it's time to register for the conference. We're getting closer and closer. We're doing so much stuff on the back end, you wouldn't believe it. Second, I have the I Am Black History shirt on the back, Black Massage Therapist. So please get your shirt to represent and we're at the conference. That you can find online. Also, we're still accepting business grants applications. So $1,000, we have two $1,000 business grants to provide you. So please fill out that application so you can possibly get a grant for your business. So let me see, anything else? Hotel, please register for your hotel. September 20th is the last day. So we have both king and queen sizes. So two queens in a room so you can share. So it's $165 a night. I think that is it for now. So everything I'm talking about is on the website, www.blackmassagetherapist.com. All right. So now let's get into today's episode. So we have Dr. Dominique. So please introduce yourself to the people and let them know who you are.
Good evening, everybody. My name is Dr. Dominique Carson. I'm so excited to be here. Oh, man. I am originally from New York City, Brooklyn to be exact. Brooklyn in the house.
I'm from the BX, but we represent today.
We represent New York. Two boroughs. That's the right. B. Yes. You got BK, BX is all good.
That's right.
I'm currently in Virginia Beach. I've been in Virginia now 4 years. I've been a massage therapist now, award-winning as of last fall. Received the Global Recognition Award, received the Global Iconic Changemaker Award for Health and Wellness. And my work as a journalist, I've been a massage therapist now 5 years. This spring, I just received an honorary doctorate in humanitarian work. So excited. It's the same school with television personality Andy Smith received hers. Monica, one of my favorite singers of all time, she receives hers. So I'm just blessed and honored. Also a speaker and an author. And I just look forward to sharing my gifts. And my overall mission is, as always, to facilitate people's lives with my hands and my words.
Awesome. So as you guys can see, she is well accomplished and is one of the reasons why she is now a speaker for this year. She is doing a virtual class, but she is going to be in person as well. So for those who are going to be in person, please introduce yourself. She's going to be around going into her own classes, but she also has she's going to have a virtual class. So let's talk about the class that you're going to have online and the title and what you're going to be representing in this class.
Okay, so the name of the virtual class is Manners, and it's Elevate Your Excuse Yourself from the Table. So the importance of this class is to understand the importance of having etiquette as a massage therapist, along with clients. But in order for clients to give you the proper etiquette, it's important for you as a massage therapist to carry yourself with a high standard. And I'm seeing, in the 5 years that I've been a massage therapist, I've been a lead massage practitioner in med spas, and the lack of etiquette for massage therapists is unbelievable.
So give us an example. So when you say lack of etiquette, what do you see? Give me
I
two,
mean,
like two
now
examples.
the lack of punctuality,
That part.
and attire.
I see. Okay, so I'm so happy you said that because currently I'm watching with my family. We like football. So they have on Netflix called The Receivers, right? So they had
Mm-hmm.
quarterbacks last season and now they have receivers. So they're in one of the receivers' houses and it said therapist, right? It didn't say massage therapist, but she's up there giving him a massage. So her shirt was kind of plain in the front, but then in the back, she got all of her back out, all this crisscrossness. And I'm
Mm-hmm.
like,
Mm-hmm.
I don't, that's my I'm like, I personally didn't think it was appropriate to wear that.
Exactly.
That's just in my opinion. I was
I
like,
agree.
her back was out and had all, you know what I'm talking about,
Mm-hmm.
and had these crisscross. And I said,
You're not going to the club, vacation. Like, what are you doing?
So anyway, so yeah, go ahead. So when you said that, I was like, ooh.
It's the truth. And it's like the way they talk to clients, no education, treating them like a number. No, it doesn't matter if you have a 15-minute buffer or 30-minute buffer in between sessions. You need to treat clients as people. If they have a right to ask you certain conditions and certain questions, it is your responsibility to know. And even if you don't know, you say, unfortunately, that is not my scope of practice, but I will give you additional information to find out.
Right.
And I'm seeing a lot of counter transference too.
Talk
And
about it. Talk about
that,
it.
that, that's a no-go. No counter transference as well. Like, you as the massage therapist have to establish boundaries. Like, you have to remember at the end of the day, your scope of practice. You're not a doctor, you're not a physician. You can't diagnose.
Right.
And I think, I'm not going to say forget, but you don't have a level of awareness to keep that in track. Like, especially it'd be a lot of the veteran massage therapists,
Yes,
before they get too complacent. I've been in this industry, I could do what I want. No, it's still a code of ethics.
Right.
You have to follow that standard of excellence to keep that going. And I just think the last thing, a lot of these massage therapists, they don't want to educate themselves. They take the same continuing education classes. There's no growth.
girl, you preaching. Listen, you are preaching today. So let me go back a little bit of the counter transference. So one thing is the dumping, right? As therapists, I've seen it. I've heard from past clients who started to go to my wellness center, was like, well, I was going to this place, but the therapist kept, telling me their issues and I'm here to receive service or, my own healing. And there was a lot of dumping going on. And so it's really unfortunate that was happening and still happening. That. And then also as a CE provider, I could definitely attest to that. Being one of the newer CE providers in the last 4 or 5 years in the industry, trying to break through because you have those who's been in the industry for a long time. And yeah, people only want to go to them. And it's not like we're not educated as well. Right?
Or you want to keep taking the same classes over and over. There's so much growth in massage therapy. That's why I love our profession, because it's so ever evolving. And it's important for you to maintain the foundation. Don't get me wrong. You got to know your strokes, but there's room for growth. There's room for improvement. I don't care if you've been in it 5 years, 15 years, 20 years. That's how you make yourself relevant in this industry. And don't get me wrong, if you build clientele over the years, you're going to have different relationships with different clients, but that has to grow. And even that, there still is a boundary.
Right.
You still have to be the professional too. Like, I had to learn that in 5 years. You're going to have clients that's going to vent to you. You're going to have clients that talk to you. That's just maybe their coping mechanism. That's how they feel comfortable to complete the session. You can give your information, just be mindful of what you give, because at the end of the day, you still a professional.
Right.
And you didn't come in for that.
You're not their psychologist.
No.
Psychiatrist, yeah, certain things you have to, put a boundary. You have to put a boundary. And also it's a distraction to what you do, right? If somebody keeps trying to, on a reverse, dump it on you and try to put all of that, onto you, you get that transference and you get that weight, right? So I would say, to my therapist who used to work for me and stuff, make sure you ground yourself in certain ways. Like for me, I said a prayer, cover myself, cover my room. I don't want whatever was going on that person coming into me, because I don't want to take that and take it home, right? You want to leave everything there. You want to, like Jay-Z said, brush that dirt off your shoulders.
Man, I know what he means. Like,
you want to.
I know what he means. Like I say a prayer all the time. The minute my mom told me, you get in this industry, you're gonna have a lot of like energies, good and bad, coming at you. People don't understand energy is not deleted, it's only transferred. And it may not necessarily anything be wrong with the client. What we do, that's a lot of psychological, that's a lot of emotional.
Right.
Sometimes I have to sit in my car for 30 minutes and play the record so I could just,
Girl,
debreeze the whole day.
I remember doing that. And also you have to think about it, because you're in this room for however many hours. Yeah, you step out, you change sheets or get some water, go in the bathroom. But for the most part, that energy. And so like spiritually, we would say some people might have some demons that you don't want that to be jumping on you. I don't want to get biblical, but
it's the truth.
It's happened. So you want to make sure you keep clear. One of the things I want to kind of go back to, so when you're saying don't take the same classes over and over again. So for instance, if you happen to be, let's just say, a prenatal therapist, is it okay to take prenatal classes from different instructors to see their different methods? Or you're just saying, just don't see that same prenatal instructor that you've been seeing for the last 6 or 7 years?
Exactly. Like there's so many other modalities. Like to me, I specialize in more like therapeutic deep tissue, but I'm not afraid to take a sports class. I'm not afraid to take kinesiology. I'm not afraid to take TMJ. Like I'm just saying, you want to broaden your knowledge as a massage therapist. You're gonna have people coming at you and say, what is TMJ? What muscles affect TMJ? I could say, the time muscles affect TMJ.
Right.
Your master, the biggest muscle in the mouth affects people. This is what I'm saying. So you don't even know what type of pathologies clients are going to come to you.
Even if they are prenatal, right? Because they have those issues. And talk about TMJ, we do have Ashley. She's going to be teaching some TMJ therapies at the conference. So that's a little shout out to her. So, but you're absolutely right. You still want to have different tools in your toolbox to be able to pull it out when necessary.
Yeah, it's like intraoral massage with TMJ. Like
that's what she teaches.
So much stuff that you have to know. Like I had a client come to me and had juvenile arthritis, stilts. This is a form of arthritis. Like I had my mom, she's in remission from myositis. She didn't even know what that was. But when I told her, and her doctor had a conversation with her, he was like, is your daughter a doctor or a nurse? And she was like, no, close enough. My daughter is a massage therapist. So that's what I'm saying.
Well, tell the people, because people might not have even heard that term. Because you
myositis. So myositis. So I'm gonna break it down. So based on prefix and suffix, itis is inflammation, and myo is muscle. So that's inflammation of muscles. It's an autoimmune response. So it's in the rheumatoid arthritis family. This is when
that's the things, right? So that's the things of breaking things down and making sure people understand. And that's why you should go and take different CE classes. So it's funny, so my CE classes, I'm in the medical side, right? Coming from sports medicine and physical therapy. So a lot of my classes is more medical based. But in the beginning, I do kind of go over a review, because I don't want to use certain terminologies and you don't know. And best believe I've had a lot of times, if I'm saying shoulder flexion, people are doing everything but shoulder flexion.
Yeah, people are like, what is that?
Yeah, they're looking around and see who else is doing it, and I'm like, no, don't look. Just everybody, let me see if
Flex
you
the
know it.
shoulder.
Yeah, flex your shoulder. You
What
got people
muscles the
going
flex?
like this.
Yep.
Right. They got, so I'm like, So that's why I do things like that, just so I can
Hmm.
set precedents to see where people are at,
Yes.
whether you brand new or been doing this for 20 years. So best believe,
Mhm.
don't think the people who's been doing it the longest are like sharp like that.
Exactly.
That's not the case, right? Because they
Exactly.
get complacent and because they're used to doing the
Hmm.
certain things over and over and over
Over again.
again, you know? So yeah, so I think your presentation is going to be great. Is very much needed in the industry regarding etiquette and
And that's all massage etiquette.
mhm.
Broadening your knowledge. That's etiquette. Like you're gonna have clients from all like walks of life gonna ask you a lot of different things, like stuff you should know the basics
At least the
to me.
basics. And
Yeah.
also, if you're working with a certain population, you need to know the lingo, right?
Yes.
And so I was, in sports, these best believe these athletes know what a rotator cuff is. They
Mm-hmm.
may even surprise you and know the muscles that are associated with the rotator cuff. And you
Yep.
up there trying to figure out which one is the external rotator muscle, right? And they're looking at you sideways.
Like
So
how you
when
don't notice, like
right,
how you
because
don't
this
notice, like
because
how you don't
especially
notice
like
thick
throwing
muscle.
athletes like baseball,
Yep.
volleyball, anything overhead, they know the muscles. So you need to be able to, if you're dealing with a certain population, you need to know that. I remember I was coaching, doing a business coaching session with a therapist, and she's out in California, and she wanted to like market towards stunt people. And I'm like, that's
Mm-hmm.
amazing. That's great. I love that. And I'm like, well, what what is it called when they do like a double roll axle stuff? Because that's the
Mm-hmm.
stuff they need to see on your website. So you're speaking their language, right? So
Exactly.
when they see that, they're like, oh, she knows what we need, right? Because you're speaking to what that issue is, what they do during, their stunts and things of that nature. So
And
yeah,
you're
so you got
right
to
with
be
the
specific.
terminology. You're definitely right. Like I had a client, she was a physical therapist. I don't know if she was trying to demean my intelligence as a massage
Probably.
therapist. And she was breaking down all these muscles. And I was like, yes, that's a supraspinatus. That is known as the suitcase muscle. And that is a part of a shoulder flexion muscle. Yes, it's the primary muscle. Like breaking down agonist muscles, antagonist
She was
muscles.
saying that.
Yeah, she was like trying to test my knowledge in the session. And I'm
Oh,
looking at her like, what did you think this was?
well, because people don't know antagonists. They don't. Some people don't. I'm not saying all, but yeah, that
I
because
was like,
that's not
nobody, but I'm
something
not gonna say that. I'm not gonna say those type of
she
muscles
should.
to my
Yeah,
clients.
but she was really trying to test you. She really was.
Yeah. And
She
then I
really
was like,
was.
yes, the internal rotator. Yes, it is called the subscapularis.
Mm-mm. People be trying, and that's something I do teach you, like when I am teaching like my medical classes and how the hierarchy, especially in because we're underneath like orthopedics, right?
Mm-hmm.
And so there is a certain hierarchy in this industry. So let's just
Yes.
say the hierarchy is the orthopedic doctor, right? Because they went to school, they're doing the surgeries, and then
Mm-hmm.
everybody trickles underneath there, right? Then you may have the PA or nurse practitioner that works in
Mm-hmm.
orthopedics, right? And then you'll have like a athletic trainer, which should be above the physical therapist because we're trained to, as an athletic trainer, I'm speaking to for myself, we're trained to work with athletes. But now you have physical therapists who are getting special certifications so they can work with athletes. And then that's been causing some issues in the industry, right? Because they're learning, like, once they get out of school, like, I don't just want to work with, non-athletic or
Mm-hmm.
unfortunately older, patients and stuff
Mm-hmm.
like that. So they're getting these special certifications so they can work with more of a sports population. And it's jumping into the athletic trainer lane. right? So then you have the chiropractor or the acupuncturist, and then you got us way down here.
Got his way, but like I said, I
Right.
give nurses their flowers.
Mm-hmm.
Massage therapy is an extension of nursing.
Mm-hmm. Mm-hmm.
I have no problem giving nurses their flowers. Like I have a greater appreciation. I have a cousin that's a nurse. I have a girlfriend that's a nurse.
Mm-hmm.
One of my good male friends from junior high is a nurse. He's a male nurse,
Right.
and he always gives flowers to massage therapists. That's a
Which
whole
should be, because my goal is to get us where the athletic trainers and PT are, because we are kind of all on the same level.
Mhm.
And what I appreciated, speaking to Mark from Canada and Danielle from Canada, they all really work with each other because they have the schooling. Now, their schooling is a degree. They get like an associate's degree for massage therapy.
Yeah, I got one too. I finished massage school in New York, so I have an associate degree of applied science.
Did you go to Swedish too?
I went to CUNY Queensboro, Dr. DeSepoli.
Oh, okay, yeah, that's right. Yeah, because when I went to Swedish, it was definitely an associate's degree. So
It was
yes,
associate degree.
but that's the thing. There's a lack of precedence in education and massage across the board, right? So you have some people like us being in New York and having 1,800 hours, associate's degrees, but then you have, states like California is like 300 hours.
Yeah.
Right. And so I know the Department of Education is trying to, across the board, make it at least minimally 650 or stay within that.
That range.
Mm-hmm. Yeah. So, and then there's people bucking against that. And I'm like, but why?
I'm like, why? I'm like, New York, Nebraska, and Puerto Rico, you need 1,000 hours. Like, are you serious?
There's another, I think Washington too. Washington is up.
Yeah, they need 1,000 too. I think Maryland just went up to like 750.
As an industry, we have a lot to do. We have a lot of work to do.
Yeah.
Hello, thanks for watching. Please like, subscribe, and share our 419 Education and Training Need to Connect podcast. So I want to get into a little bit things of challenges. What are some unique challenges you face as a Black massage therapist, and how have you overcome them?
Not really a challenge. It's just what I've discovered.
Okay.
In all the years I've been a massage therapist, a lot of times I was the only African-American massage therapist in the places I've worked. And I just feel like it wasn't enough of us being educated, being in this industry, and just doing my own history. Like the first African-American massage therapist was Delilah Baisley.
Yes.
And she started off as a massage therapist and then a nurse. So when I was informed about your conference, I was like, hands down, like, we need to be represented. And a lot of massage therapists are women. Yeah. But how many of us are African-American? Maybe 10%.
Yeah, so we're 8.8% as of the 2019 stats. Yeah, 70% is white women.
Yep.
So there you go. That's what
that's a problem. And I had a client. I love her though. She's such a sweetheart. She was like, "Where a Black therapist at?" She said it so loud. And I said to her, Miss Wiggins, I'm your therapist. And she was like, "Oh yes, finally one of us."
Yeah. Yeah.
So, like that shows that we still have a lot of work to do. Unfortunately, all the people I've worked with until recently, it's not a race. This is a whole thing that all my former employers and former coworkers are going through. I've been very fortunate that my nationality wasn't an issue. Okay. And, the owners were blessed to see my talent.
Amen.
They loved the fact that I was coming from New York. So they knew I was coming with a lot of rigorous education. Because I was asked in interview when I first started working at Bliss, what is the definition of massage? And when I gave the textbook version, it was like, okay, like she's been studying. Because there was a lot of things that they drilled in us at CUNY Queensboro, things to know, the foundation. What is the overall goal in your session? Right. Like, what is the overall goal in massage? Right. We're helping circulation and muscle tone. Those are the primary goals. As your primary objectives as a massage therapist. What is the definition of massage therapist? You have veterans and they can't even answer that. When I said the definition, the intentional and systematic manipulation of soft tissues to enhance one's health and well-being.
What?
Yes, I was
Girl.
introduced to that 8 years ago when I first started massage school.
And she still remembers
And
it.
I still remember.
That's
We're not
awesome.
playing.
That's
Yes.
awesome. So let me ask you a question. Going to SUNY Queensboro,
Mm-hmm.
well, CUNY, is CUNY?
CUNY. Mm-hmm.
CUNY. All right, let me not say that. Okay. The city, New York City, have SUNYs and CUNY schools. So we
Yes.
have state universities of New York and then city New York
Yes.
universities of New York.
Yes.
So going to Queensboro, what was the population like of therapists? Because New York is not as diverse as when we grew up. I'm gonna tell you
Yeah.
that much. That I know for sure. Just going back last year, I was like, oh, this is not the same as I go every year, it's not the same. So what
It
did it
was
look
an
like?
adjustment. It was definitely an adjustment. When I studied in Brooklyn College and graduated from Brooklyn College with my undergrad before I went back to school for massage, it was very diverse. Like you had one side of the campus, the Jews, the other side was the Caribbean.
Mm-hmm.
When I got to Bayside, it was very few of African Americans in the massage program. It was like that 5 to 10%.
And I think
And
that's even.
I remember the anatomy courses. And I remember when I was taking anatomy, and it was like 20 students. And by the time we finished the final semester, it was like myself and maybe 3 other African Americans in that anatomy class because people were not staying in the program because of these science courses.
They don't realize it. Okay, so I did a stint. This is when I realized I am not a teacher for the standard schools, massage schools. So I did a stint, on that. So I taught, based on my background, all the science classes, the anatomy class, the kinesiology class. All right, so I got my master's at Columbia. She tries to teach us like we are at Columbia University. And I'm like, that was like, you know how you get reviewed? I got reviewed that as an instructor. I said, what? No, I'm not. Like, you have to, I don't know what you thought this was, but you need to know the muscles. And so I had like the director at the time was like, yeah, Devonna, so you're gonna have to dumb it down. And I'm like, I don't know what you mean. And I'm dead serious. And he was like, yeah, he had one of the other teachers. He was like, show her how you usually teach this class. And so she's like, well, I teach it towards like a third grade level. I'm dead serious. And I said, oh, well, how do you do that? Cause I'm like, how do you do that? So she told me, she was like, you're going to have to get magazines, cut out pictures. Like, it was like a whole thing using stars when they get good. And when I started doing some of that, I'm not going to kid you. People were like looking for like their stars on their, if they got like a hundreds or whatever in the 90s, they was looking for their golds and silver stars. I kid you not. This was some years ago.
Wow.
But after
I have
that,
not experienced that. And I was at a community college.
I'm trying to
I
tell
thought I was
you.
going to school to be a nurse. That's what I thought.
Yeah.
And the anatomy professors I had, especially, I had to take anatomy 1 over. I missed it by 2 points. I buckled down. I got a C plus because you got in with massage. We had a C to stay in the program. But when I got to anatomy 2, and I had Scott Sherman, he taught it rigorous, but he was more patient. He started breaking down the etymology of words. And that made me start to feel more comfortable. I promise you, not that though. They didn't care. They was like, you are responsible.
But that's
You
the
have 2
levels.
absences. If you have 2 absences, if you're absent, you fail the course. Like we had to be in the classes. Like if you were not there in 10 minutes, you were absent for the day. Like it was no like I'm catching man. No.
That was my experience. And I was like, well, this is not going to be for me. So I did that for 1 year. And then, I was like, nope. Because I was part-time at a PT clinic. So working as an athletic trainer at a
Mm-hmm.
PT clinic, and then I was part-time doing the teaching thing because I think I taught the morning
Mm-hmm.
session. And that was another thing. If the student didn't pass a certain class, they wanted me to stay later to tutor them because they didn't do their homework and stuff. And I'm like, listen, y'all asking way too much because these people had the amount of time that was provided to get this work done. This is on them. So it was this whole, political stuff on the back end. I'm not going to
Mm-hmm.
get too deep in that. But that's what I was like, this part is not for me. Not all schools obviously is like that, but that was my experience when I did do that little stint.
And they had no mercy on us. They told us. I remember they told us when we first started anatomy and massage classes. They was like, "Some of you may not make it to the end."
A lot of people
They
didn't
were
make it to
very
the end.
blunt. They were, oh,
In my school, people didn't make it to the end. Because at Swedish, you learn Shiatsu 101, Swedish 101, Shiatsu 102, Swedish. We did A&P, we did kinesiology. It was like,
did it at QCC. We had, instead of calling it shiatsu, we called it Eastern massage. You
okay.
had Western one. You had kinesiology. You had myology.
Mm-hmm.
It was like, no,
Mm-hmm.
if you can't handle the workload,
Mm-hmm.
this is the workload. If you go to school full time,
Right.
if you go to school part time, I went to school part time, and the load was
Yeah,
serious.
yeah, the
Three
loaded
classes
share.
was serious.
Yeah, because there's a lot of information.
Yes.
All right, so let's talk about what advice would you give to aspiring Black massage therapists who are just starting out in the industry?
Well, before you graduate and before you go to school, you need to figure out this is what you want to do.
Mm-hmm.
Once you really decide this is what you want to do, it's going to be a lot of, like we talked about, a lot of studying. This is not living environment in high school. Like, and that was my reality check.
Mm-hmm.
Because through all my schooling, I've done pretty well.
Mm-hmm.
Especially if I just study science and social studies, I can get a B. When I first started massage school, no. I was studying sometimes 2 hours going to school, 2 hours coming home from school, tutoring, everything you name it. I had pictures and figures of muscles. Like my family was like, is she really going to school to be a massage therapist? Or is she going to nursing? Like that's how like intense my studying was. Secondly, I would say trade as much as you can, whether you're just a recent graduate or you're still in school, and study. Like we said earlier,
Mm-hmm.
like the more you study, the more you stand out as a massage therapist. I'm 5 years in
Mm-hmm.
and I'm still studying, whether I'm looking at a textbook, whether I'm looking at videos, because you just never know. Like I said, I had many pathologies and conditions, and people was like, oh my God, I didn't know what that was. Like people saying I had fibromyalgia. I was like, yeah, the other name for it is fibrositis.
Mm-hmm.
That stuff just from studying
Mm-hmm.
in this field, and then figure out like, what do you want to study? What is your specialty? Yes, it's good to have other modalities, but what is the modality that you love to do?
Right.
Like I don't know, I love therapeutic, I love medical, and I just love all the other modalities that you can use, like the hot stones and salt stones. But my niche is therapeutic. I love therapeutic pressure. I love getting into the deeper layers of the muscles. I just love deep tissue.
Right.
And that's what I've come to understand within the last 5 years. And like I said, it may change.
Right.
It
Right.
may change again.
Right.
And then I say passion. Dr. Salvo, Susan Salvo, this is one of my mentors
Okay.
in therapy. She broke down the acronym ASK for massage therapy. It's you have to have awareness, skills, knowledge, eager, desire.
Okay.
And I would encourage us to follow that acronym, no matter where you're at, especially when you're starting, to follow that acronym in this industry.
I love that. I love that. So I know Dr. Salvo, she definitely donated last year some books to the conference. So that was nice of her. So
Yes.
last thing we're going to just kind of head out is, are there any specific, so you're talking about resources, are there any specific educational resources, books, or courses you would recommend for ongoing professional development?
Black Massage Therapist Conference.
Hey. That's what I'm saying.
That's one of them to learn. Like, and it's only gonna grow, and
Right.
it's only gonna multiply. Because, like I said, I've been around several massage therapists from nationalities, but I'm so looking forward to this conference because it's minorities.
Mm-hmm.
You can relate. You'll have similar issues, similar paths in your field.
Right.
You have AMTA. I'm a proud member of AMTA. I've been a member of AMTA since I've been a student massage therapist. You have ABMB.
Yeah.
You have so many
Yeah, I
providers
mean, yeah, because AMTA, that's our premier
classes.
sponsor. They're our gold sponsor. ABMP, they'll be there as well. They are our bronze sponsor. So, yeah, so they're in support of the conference because they know the necessity of it.
Yes. And the podcast. And you have Mark. I was on his podcast.
Yeah.
Yes, I was
Oh,
on that during the
good.
pandemic. So I'm so excited to see him finally in
Right.
person. I remember he interviewed me when the pandemic first started. So
Mm-hmm.
there's so much stuff you have out
Mm-hmm.
as a massage therapist, and stay in touch with the schools you graduated from because you don't know what resources that they can give you
Right.
too.
I like that. I like that. So I would like to thank Dr. Dominique for coming on the podcast. It was great conversation. It's nice to speak to a fellow New Yorker. Sometimes probably when I hear that,
Yes.
my New York accent start coming out because people are like, are you really from New York? And I'm like, yeah. And I'm like, just you wait. There's certain things that still come out like water,
And
right?
coffee.
Coffee. So, but I really appreciate you. I appreciate you, reaching out to myself and my team to say this is something that you want to be a part of. And look, this is only the beginning, and it's only
And
going to
that's
go
another
up.
thing that you can do. Reach out. If you feel like there's an opportunity and you feel like you could contribute, try. The worst that I look at it this way, and I've always, the worst that the person is to tell me is no,
Right. There you
or
go.
it's not available right now.
Right now.
And
And that's
no
what we
means
said. Yeah.
next opportunity.
Right. Hey, I like that. I like that. Because,
Yeah.
as an organizer, I could hear some no's. So thank you.
Yes.
I received that. I received that. So thank you. And so everyone, please like, subscribe, and share this conference or the conference, yeah, and also the podcast with people who you know. And hopefully we will see you soon. And I will see you at the next episode. Bye.
Bye.